Dr.
Dr.
Phil,
Wayne.
Dr. Nelson, welcome back to Courageous Conversations. So good to see you, be with you, and hear your mellifluous tones.
My gosh, I wish I had the same characteristics to spout back, but I can't say those words.
Every once in a while, some of the synapses in my brain go back to SAT words that we had to memorize, and
Ah,
they come out. And my wife picks on me just like you do when I use words. It's like they're not part of the normal jargon.
no, I'm assuming that those were compliments, but I have to go look up the definitions later.
You can just ask Siri what it means. All right, so we want to thank Nationwide for their support in allowing us to have these courageous conversations, and Nicole for her support in editing out our ums and uhs and yeah and whatevers, because she makes us sound a lot better and a lot smarter than we actually are.
And not to mention the four-letter words that
Oh,
we can't spell.
yeah, well, that's true. I think we're pretty good about being careful about four-letter words. But yeah, every once in a while we kind of let some bombs fly. So I got a topic for today, and it's right in your wheelhouse. And it comes from one of our colleagues. Now, for those of you who are listening to us for the first time, welcome. For those of you who have been listening to us for a while, welcome back. Just a quick brief bio. Dr. Nelson is a former dean at Western University, soon to be the founding dean at a new veterinary college in Georgia that'll be opening in the near future. I have been a part-time faculty at Western, so we do come from an education background. Oh, and by the way, both of us went through veterinary school, so we had the benefit of being educated, and now we contribute to the education of the next generation of veterinary students and veterinarians. How'd I do on that, Phil?
Yeah, pretty good.
So for those of you who are keeping your finger on the veterinary pulse, and yes, we do have a pulse, there is a discussion and there is a evidence of a need to help with the veterinary workforce. And one of the responses to that is the development and launching of a number of new veterinary schools around the United States. I've heard anywhere from 12 to 15 new schools that will be matriculating students in the not too distant future. Is that a fair number, Phil?
Yes, it's a little bit of an exaggeration. Almost nearly half of those schools are globals or are international schools. We're talking about the schools that have applied for AVMA COE accreditation. And so some of those new schools are not in the States.
Okay.
They're elsewhere. But at least 8 to 10 of them are being planned in the United States.
And so, you know, as an adjunct faculty at Western, I'm aware of the ongoing needs to hire faculty members at that university. And there's discussions at many of the other universities of a need to hire ongoing faculty to replace turnover and especially at the clinical level to bring in clinical teaching because of the number of private practices that are hiring specialists to work in private practice. So there was an article in the recent Journal of the American Veterinary Medical Association, authored or co-authored by retired Dean Michael Larimore, entitled "An Imminent Need for Veterinary Medical Educators. Are We Facing a Crisis?" And I think the first part, an imminent need for veterinary medical educators, is a reality. The crisis part, well, that's part of what we're going to discuss today. Phil, I know you've had a chance to look at it. I've had a chance to look at it in terms of the article, but it also is something we have talked about offline. And how are we as a profession going to meet the needs of increasing numbers of veterinary students, and the universities are already being stretched to currently find faculty members? I mean, let's just start with the present. How do we start to meet the needs of the present so we can meet the needs for the future?
As a experienced dean, I'm embarrassed to say I don't know. I'm not sure that is the road to take. I think the reason we're here is because of the road we've taken. And I know it may sound as if I'm being reflective, but I am, it's a little like going to destinations unknown, having fun on the trip, and then suddenly realizing that you aren't prepared for the geography that has suddenly appeared before you because you've been having too much fun, having fun rather than preparing for the end in mind. I don't think we're going to solve this problem pointing fingers or 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 establishing blame other than to make observations that we do every day in practice and then address the issues. I mean, some of this we dealt ourselves in terms of academics. We serviced an industry by providing graduates who ended up eventually, after some turmoil and some difficulty, eventually our graduates have have supposedly much better lives than the faculty that taught them. They may argue that because of other extenuating circumstances like student debt, lifestyle, etc. But those aren't issues that faculty or education necessarily control. Those bring in other extraneous issues as well, as far as the economy is concerned, as far as how we choose as a society to fund our education, how we choose as a society to pay for our education. You can't put all of this at the feet of academic medicine. But that doesn't change the prism at all. It doesn't change the geography that we're looking at. And the geography that we're in now says that for at least the last 2 to 3 decades, we have not necessarily aggressively recruited for academia. Teaching has taken a hit. Education has taken a hit. It seems it's the first place, it's the first martyr of politics. You know, when an esteemed public health official comes before Congress and is refused to be saluted as doctor simply because you don't agree with the prescription that he made to the nation, shows you how ephemeral our respect for education really is.
Yeah, Phil, it's sorry to interrupt, but granted, we're talking specifically about the veterinary field from an education standpoint, but it's not just the veterinary field; it's education all the way down to primary school that is dealing with teachers and keeping teachers and supplying teachers with the supplies that they need, so it doesn't have to become an out-of-pocket expense. So I think reflecting as you are on the more global aspect of education is a good way to start.
Yes, thank you. I appreciate your making my point better than I did, but because that's exactly what I'm trying to say. That this is not just a problem with veterinary medicine. This is a problem in education first and foremost, and the lack of recognition that we are the society that we are because of education, because of our advances in education. And our recognition of the egalitarian effect of education across all aspects. Veterinary medicine is no different in terms of its benefits or its consequences. It is a glorious profession, and I've rarely questioned my choice of being a veterinarian. I have questioned my choice of being an educator sometimes, simply because the recognition and support for something so pervasively positive is so quickly trashed. I'm tired of using the phrase third world countries now, but in countries that are less stable, the first people that usually are ostracized are the educated because they're not as easily duped, and I'm gonna leave that there because I don't want to get in trouble in terms of how easily people can be duped. But Dr. Larimore is perfectly right in if it's not a crisis, we're in danger. A crisis, in my mind, is something that says we must correct this now, and we may have and there's only one way to do it. I don't think there's one way to address this. I think this crisis has been created by a monolithic approach to education. It has been created by a pattern of false assumptions, and it has ignored, in some aspects, the advances we have made in adult education, in professional education, in medical education, and that and in order to change, we're going to have to get more and more people involved. But I believe it's a mistake to be so myopic as to just focus on veterinary education issues when the issues are much more prescient in the education field across the board, from kindergarten to graduate school. And there are a bunch, and obviously we're going to get tied up in some of the other silo issues, like how are we going to handle specialists versus generalists? What's the role of the vet tech in the veterinary industry? What are we going to do about access to care? What about the expense of medical care or veterinary care? What about the role of the veterinarian in protecting our food supply? What is the role of the veterinarian in global in climate change? All of those things have an impact and makes your head hurt, because we've never had a national discussion about the need, about this country's need for veterinarians. And part of our problem is that we put band-aids on those societal needs that we should readily fund, but we can't even discuss it because we can't decide if we're going to show a human being the respect of giving him his title.
Okay. On that note, thank you so much for joining us today on this podcast. I don't know how we're going to cover all of that information in such a short period of time, but I do want to try to get it back to an area that is, to me, of greater concern and interest to me, which is the veterinary side of things. And so I look at veterinary education, and again, I'm looking at it really more as an outsider than it is an insider. You're an insider more so than I am, as two levels: basic sciences and clinical sciences. And many schools blur the lines throughout the curriculum, but for the most part, the first portion of your education is a basic science study of the ologies and anatomies and all sorts of different things that give you a foundation to use on the clinical side of it. And there tends to be a roadmap that you follow that gets you prepared so that by the time you're entering your third or fourth year, you're prepared to work with patients and work with clients and start to work in the clinical side of veterinary medicine. And the broad basis of the education is, as Dr. Nelson noted, because we are producing public health veterinarians, we are producing food animal veterinarians, we're producing equine veterinarians, we're producing companion animal veterinarians, we're producing teachers, we're producing all sorts of different people, all going through the same 4-year curriculum. And so we need teachers to present this information that gives you a foundational veterinary student coming out of school. And I may be wrong, but my thoughts are there's a different way to approach basic science teaching and a different way to approach clinical science teaching. And so we've got this pool of people who are teaching, and they've been teaching at the 30 plus veterinary schools in the United States up until now, and some move around from school to school. But as we add new schools, and as Phil noted, we have a shortage of teachers globally, and I would then anticipate we would have a shortage of teachers in the veterinary curricula going forward. Do you foresee, if we continue to follow the same path, do you foresee, Phil, difficulties filling slots in the basic sciences and clinical sciences if we just continue to do things the way we've always done them?
Absolutely. And I think that's what Dr. Larimore was trying to point out
Right.
in his article, that we can't sustain what we're doing and meet the demand for of society. First of all, let's establish that there is some discussion about the depth of that demand, the size of that demand, or whether it is transient or not, whether it can be met through efficient management or not. But I would dare say that anybody who's riding that train in terms of efficiency is has just as much of a challenge as we have trying to address these issues through the status quo by just doubling down. And I just don't think that will work. I think you have to understand that you started. I want to differ just a little because I like differing with you on our approach in education. And I shouldn't say I differ. You're absolutely right. That's the traditional way of looking at professional training. Is there's the didactic, and then there's the clinical, as if that's how you learn to ride a bike. There's the physical, and then there's the mental. There's the you learn how to pedal, but you also have to keep your balance. And I don't know how we got so dependent on categorizing these activities, so much so that we've separated them. And so I think that one of the things that has to change is our concept of education, so that we have an integrated approach to education, that we look at what we're trying to produce. And what we're trying to produce are clinical scientists who can walk and chew gum at the same time, who can merge the clinical with the cognitive development that they need to become clinicians or researchers or public health specialists or whatever aspect of veterinary medicine they want to go into, which means you need a blended approach in teaching, and to have didactic / cognitive years versus clinical years is unseemly to me, for lack of a better word. It's almost as if in education we decided a long, long time ago, before you and I were educated, before the wheel was invented, that you had to learn the hard stuff before you could do the fun stuff. And yet we all know that if you get to do the fun stuff while you're learning the hard stuff, you're motivated to learn the hard stuff even better. If you can integrate the cognitive development into your psychomotor skill development, you're a much better clinician, as well as by the time you graduate, you're much more competent. Habit literature says you need to repeat things for 1,000 hours before you become an expert at it.
10,000.
10,000, I'm sorry. 10,000 hours before you become an expert at it. Whatever the number is to become competent is what we're trying to achieve, but we aren't even achieving that if we cut off half the curriculum just so we can focus on the mind, rather than using the entire curriculum for both. So that's one change we have to look at.
I mean, but Western, when you were part of its initial launchings, changed the mindset, and it was the most radical change in millennia in the veterinary education field.
Well, thank you for that. But and you're right. The faculty at Western, the founding faculty, the founding dean, Shirley Johnston, came in with some radical ideas, and we did make it happen. But it was a radical movement away from what we had done, but it was not a radical discovery.
Now, what you're suggesting on top of that is that we need to even move further into a different way of teaching than Western brought to the fore, if we're truly going to make professionally competent veterinarians at the end of the curriculum. That even the changes that Western made were a baby step in the bigger picture.
Yes, I am suggesting. I'm also suggesting that it's not simple procedures that have to change, but design must change. Concepts of involvement must change. we must start using the whole ecosystem of veterinary medicine to produce new veterinarians. When you and I went to school, teachers taught, practitioners practiced, and then we developed specialists, and they specialized. Some of them taught, but the only people who could teach, really teach, were faculty. And we created these artificial environments for our students to learn we thought in their best interest. We thought it was in their best interest to protect them in a glass house and teach them everything they needed to know before they went out and could hurt animals. But in the process, we created an artificial environment where human nature could go awry. We protected them from the business process of veterinary medicine. We protected the faculty from the budget pressures of veterinary medicine. The way we funded it without accountability in some created a nebulous environment of financial escape that did not necessarily prepare our graduates for private practice. We created these Taj Mahal tertiary centers that are expensive to run, but are so important in the advancement of veterinary medicine that we invested more and more into it, to the point that it was hard to find a patient in a tertiary hospital that had hookworms for the student to learn how to do common treatments. So we created some of the problems based on some of the assumptions that only faculty can teach, that we can't use, and that practitioners have to a different level before they are recognized as teachers. One of the things that we did at Western was we began to realize we took advantage of the fact that there were plenty of people out there that can teach generalists, as long as they're willing to follow what we've learned about adult education, as long as, for whatever motivation, they're willing to participate in the procedures that result in a competent first-day graduate. We don't have to depend solely on the core faculty cohort. We still need them. Don't get me wrong. We need them for advances in education, advances in science, advances in treatment. But we shouldn't ignore the rest of the veterinary community in addressing this issue. And right now, we don't have a very easy way for retired practitioners, retired specialists to easily rejoin the ranks part-time to help teach.
Thank you for saying that. Okay, first of all, thank you for giving me a chance that I wouldn't screw up your students at Western by employing I don't even want to say retired, but a clinical practitioner who was never a member of the faculty at a university, and who actually was probably rebelling against the faculty at most universities, and was probably fairly revolting to many faculty members. So thank you for giving me that chance.
You're welcome. And you are revolting, to many faculty.
I know that. But I think the point that you made, okay, so if we were to continue on the same path, the road most traveled, and we continue to teach the same way, we are going to have a problem, because we just can't, it's an unsustainable situation. On the other hand, to try to look at changing the way we teach and bringing in new minds and new ways of teaching comes with a time frame to ramp people up, to get them up to speed. The concept of bringing in those veterinarians who have actually, quote unquote, done it in the clinical setting, in a private practice setting, to teach, is something Western has done in their PBL, the problem-based learning classes, and also in some of the clinical side of things. And we do that in many of the veterinary schools in their clinics. And I think some of the best faculty I had when I was going through the clinics at University of Illinois were those who had been in private practice first, and then came back into the teaching modalities, either as residents or teaching faculty from that standpoint. But the bigger picture problem is the pool from which we are fishing is drying up. There are fewer and fewer resources, to the best of my knowledge, unless we can start to help repopulate the pool of future educators. And I'm going to use the term educators more so than faculty, because I think really what we're doing is educating, and I think that supports, but both at the basic science level and the clinical level, we need to enhance that pool. And I do love the concept of applying basic sciences, not just absorbing basic sciences. And sometimes I felt the first 2 years of veterinary school could have been done by tube feeding, because it would be a lot less painful than having to absorb it slowly. You might as well just put in a nasogastric tube and just fill my stomach with it, because at the end of the semester, all you were doing is regurgitating. But I love the concept of how do we take and meet all of the needs of society that veterinarians do, all of the content that we are asked to learn in an applicable fashion. It just is overwhelming to me how a dean puts together a team of individual teachers to do that.
How do you eat an elephant?
You don't if you're a vegetarian, but I get the point.
That's how a dean does it, one bite at a time. I think, at this point, and in response to Dr. Larimer's challenge to the entire profession, and Michael, I just want you to understand, I'm giving you as much promotion as I can. I'm going to stop using your name in a minute. At this point, I think it's important to realize that in order to forge new paths, in order to discover, there's a saying, in order to discover new country, you must leave familiar shores. You must lose sight of familiar shores. And so you don't do that. It's difficult to do that in one fell swoop or with some superior design. Usually it's by trial and error in small steps forward, right? So let's look at it this way. I see, if I can make an analogy of where I think the veterinary profession is. If you've ever gone to the beach and gone out into the water, into the ocean on a beach, and you were having fun, and you suddenly found yourself 1/3 of a mile out from the beach and didn't realize you had gone that far. And then all of a sudden, tide comes in. And now you're not touching bottom anymore. And you don't swim that well. What do? Do you yell for help or do you start swimming? Especially if you yell and nobody hears you because you're too far out and you're wasting breath just yelling. Generally, you just swim. You don't think you're going to make it, but you don't give up. You swim. And you find tactics of resting and swimming and resting, and eventually you make it back, right? I think that's where we are. I think we looked up, we found out, we realized we weren't waiting anymore. We're literally in over our heads. We don't know how we got surprised, but it's time to start swimming.
Yeah, let me add to that metaphor, because I think if we read into a lot of the stuff, it's not a tide, Phil, it's a riptide.
Okay, whatever.
But no, I mean a tide,
yeah.
you have to know how to swim with or against the riptide to get out of it.
Yeah, and that is trial and error too.
Yeah,
because riptide will change on you, right? So my point is that every time I've gotten into these discussions, it usually starts with someone saying, "So where the faculty going to come from?"
Where the faculty going to come from, Phil?
And wherever they're going to come from, wherever I can find them. I'm going to start looking for them under rocks where we haven't looked before. Those
are called gravestones, but go ahead.
Yeah, either way. No, that's a little late. That's what pathologists do. I'm an internist. Okay. But I'm going, we're going to find them and we're going to find quality people that we used to shun, or at least made it difficult for them to come in. There's going to have to be a change in recruitment styles. As a dean now, I'm going to have to accept the fact that if you want 5 days off every 2 months or so, I may have to figure out a curriculum that'll fit you. If you want to work remotely, if you don't want to worry about tenure, then I may have to come with a compensation package that will attract you and still take advantage of your experience and your expertise. One of the things we learned at Western was the value of experience. not just the value of a degree. The fact that many of some of our best teachers, our students would come back every year, they pick a preceptor of the year for each of the years. I think you were one of them once. But they would pick a preceptor of the year and extol their talents. And I couldn't tell the difference between them and a faculty member. Those people enjoyed the teaching that they were doing, but more importantly, they were just as competent. We're the ones who created these barriers. And when I say we, I don't necessarily mean academia, I mean society. Because these barriers are not just in vet med, you know. But I have to say, industry has stepped up to the plate too. Industry is suffering just as much, whether you're talking about corporate medicine or whether you're talking about pharmacy or whether you're talking about any of the other vet-related industries. They too would like to see our coffers filled fuller. And they have a role here as well that we have to learn to integrate and assimilate in our response.
I want to do a quick shout out to our 13 listeners and suggest that many of you were benefits of the COVID spend that national companies did, and you are about now coming up on your end of your employment agreements. Now that you've got enough money to retire because of the large checks that you received, reach out to the veterinary school in your community or within a reasonable drive of where you live and see what you can do to be part of the next generation of educators at those schools. Because I do think, as Phil has noted, we don't have to turn over a lot of rocks unless we're talking about money being a rock, because we have some great people who have made some very successful businesses that could be the next source of educators out there, and talk about how they became successful as clinicians and ultimately as business people. And many of us, including myself and Phil, listen, if you hadn't recruited me and cajoled me and coaxed me, I can't say you paid me a lot, but I probably would have been doing something else. But I do think it's very rewarding. And so I want to reach out to the veterinary community and say, we can help solve some of this problem, if we want to call it that, by giving back to the veterinary curricula that are the current existing ones, as well as the new ones.
I'd like to expound on that point for a minute, because I think this is one of the reasons, one of the places that academic medicine has failed miserably. And that is indulging the importance of gratification. Teaching is an honorable profession. You're right, I didn't pay you much because I understood the gratification one receives in helping young people achieve their dreams. The reason I stayed in academia is because of that. I didn't get paid a lot either, but I had a different lifestyle as an academician that I was satisfied with. Though I may not have the home that I may wish I had, or I may not have the home that I've seen others have, I've had a good life. I have more friends than I'm.
And me? You have more friends than me?
Yeah. I have more friends among former students I consider friends. I have more friends among my colleagues that I participated in their development, that there's a sense of investment that I get a return on every time we talk. That's important to real teachers. And almost everybody enjoys helping others out, helping others. Now, I'm not saying that that we need to take advantage of that. I'm saying that that's an aspect of education we do not promote. So much so that we don't understand the insults we hurl when we want to say that teachers don't care. We had a guest in one of our conversations who suggested that teachers are too busy, that they're part of the woke group, that they have political agendas. Suddenly, their political views become the ultimate motivation behind their teaching. They're there to to lead students astray or away from their home teaching, when in actuality, they're just teaching math or science, and they're spending some of their own money to do it, you know. And so, on the one hand, our lack of defense of education leads to the easy dismissal of the importance of education within our society. And I'm just as guilty of not defending the importance of education enough.
And I'm guilty of it as well. I've not always had positive things to say about the educational process at all levels. Somehow I turned out okay. Somehow you turned out okay. And somehow the people we have metaphorically touched have turned out okay. I think this is a very deep conversation we had today, and I think we're just scratching the surface, and one that we should continue on a subsequent podcast. And I think we could even throw some ideas out there to help address some of the issues down the road. I do think this is going to be very impactful and influential on the next generation of veterinarians. And we have millennials and Gen Zs who are now in the pipeline. I think we've actually graduated some Gen Zs into the veterinary world as well. And I think learning is different. I think teaching needs to be different. And I think part of this conversation is, how do we change from where we were to where we need to be?
I just want to add one cautionary note, and that is teaching content required to teach a generalist, which is the goal, which is the ultimate, the immediate goal of veterinary professional education, is the same all over. The delivery of that content is what we've been addressing. How we handle, how we present and or inculcate that content is what we're talking about here. But the content itself is not being diminished. Competence is still the goal. Now, for those of you who are thinking maybe this might be a role, there may be a role for you here, please be aware, we're not looking to produce mini-me's. We're not looking to produce your role model. That comes after they become the generalist. That comes after that comes with additional training. You know, if they want to remain a generalist, we need them. If they want to become a specialist in an area, we need them. They want to take the veterinary profession into a different fork in the road, we need them. But there are stages of education that we seem to forget. There's birth, pre-kindergarten, elementary, secondary, college, postgraduate, professional training, and then there's specialty training. Decide which way, where you want to be.
So in 2010 thereabouts, AFMEC gave its report entitled Roadmap for Veterinary Medical Education in the 21st Century. We're in the 21st century. We're pretty deep into it already. And we are continuing to change the roadmap. And I want to wrap up today's podcast with Robert Frost. He's not a veterinarian. He's a poet. The road not taken, last paragraph. I shall be telling this with a sigh, somewhere ages and ages hence. Two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. I think, Phil, what we are saying is that we need to take the road less traveled going forward so that we can continue to move this profession and professional education forward as well.
I will leave it at that.
Thank you, Nationwide. Thank you, Nicole, and thank you to all our listeners. And we will be continuing this conversation because it's not over till it's over. No, it's not over because there's so much more we can dive into it. So thank you, Phil.
Thank you, Peter.